Dare County is the easternmost county in North Carolina and covers an area of over 1,000 square miles, of which only 1/3 is land. It is home to over 33,000 residents and stretches from the northern shores of Duck to the mainland on North Carolina's eastern coast to the southern shores of Hatteras Island. The remote location, coupled with the seasonal population of a tourist economy, presents distinct challenges for our community.
When we realized our son had a substance abuse problem, he was a teenager, and we felt like there was no place to turn. At the time, there were no things in place. At the age of 19, he did pass away due to substance abuse, and we felt like the outcome might have been different had there been resources available to us.
We have a good quality of life here in Dare County, but in 2002 we did a health assessment of our residents and found that substance abuse, in their opinion, was the #1 health problem facing Dare County. And with an examination of the medical records, with the looks at arrest records, with looking at schools and the problems they were having in the different realms of violence there as well, we came to the conclusion that substance abuse and alcoholism was rampant here, a lot higher than the average. With that, state and county officials held a community meeting here on Hatteras Island to discuss the problem.
I was a prosecutor in Dare County from 1991 to 2003, and during that period of time, felony drug prosecutions increased dramatically. I became very frustrated in handling these drug cases. The same people were committing the same crimes over and over again, and our local treatment options were non-existent. You're not going to win the war on drugs just by putting people in jail. Investigating and prosecuting drug cases is expensive for taxpayers. If you don't focus on the prevention of substance abuse by providing good treatment options, then the drug crime problem is not going to go away.
We had a serious countywide problem with drug and alcohol abuse. Arrests were rising, overdoses were increasing, kids were dying, and people struggling with addiction weren't getting the help they needed. We had to do something to stop it. Inaction just wasn't an option. This is Dare County's story of what we did and why it worked. As a resilient, can-do community, we faced this challenge head-on. We took a comprehensive, collaborative approach to develop a plan for preventing and treating substance abuse. Today, our substance abuse program has shown consistent and positive health impact in Dare County, and we believe it could be replicated in other communities. We began by conducting a thorough needs assessment, which included community meetings and forums with wide participation from stakeholder groups, 2 surveys, one for adolescents and one for adults in the community, 10 focus groups, collection and review of data, including comparison to national trends and similar communities. We looked into local services and professional resources, potential treatment center sites, and potential funding sources. And we did on-site observations of key points in the intervention process, including law enforcement, juvenile justice, the medical services, and the self-help community. Then we developed a plan for a continuum of services, including prevention, intervention, immediate access and response to substance abuse crisis, and treatment. In particular, we worked to close gaps in services.
The Dare County Department of Public Health, in collaboration with the Dare County Schools, provides substance abuse prevention education to students in elementary, middle, and high schools. Our goal is to reach students starting in the 3rd grade and follow them all the way into high school, and to give them the education and motivation they need to make good life choices. We also provide a variety of education for teachers, parents, and youth in a variety of settings.
Being a teenager is really hard. People want to influence you to do bad things, and when you go to parties, you see everybody drinking and doing drugs, and you're like, oh, that's cool, but really it's not, because you don't really think about how your life's going to be affected. Positive action has helped me make the right choices in life and not to let peer pressure get to me.
There is no wrong door to treatment. We have trained area physicians and providers on the use of a routine screening tool that identifies people at risk that would respond to a brief intervention and referral to treatment. And as a result, more people have been referred into substance abuse programs because more providers have been trained to recognize the problem. Also, a full-time counselor works within the criminal justice system to facilitate intervention and treatment for offenders charged with alcohol and drug abuse crimes.
A major success story was the establishment of New Horizons. New Horizons is an outpatient treatment center that provides individual and group counseling, assessments, as well as family services. The clinical staff at New Horizons use proven, effective, evidence-based treatment models such as motivational interviewing, GAIN assessments, and 7 challenges. Most of the clients at New Horizons don't have any form of insurance. New Horizons has provided a lifeline to individuals in Dare County struggling with addiction. And we initiated a 24/7 crisis call service staffed by qualified substance abuse professionals.
My name is Stephen Sines, and I've struggled with a cocaine addiction for the past 30 or 40 years. I was diagnosed last May with cirrhosis of the liver and hepatitis C. I needed a liver transplant, and I needed to go through a program before the doctors would consider putting me on a transplant list. I joined New Horizons May of 2012. It took me 3 months to get clean, but I've been clean for 8 months now with the help of New Horizons and the programs that they offer.
The Dare County Department of Public Health partnered with the College of the Albemarle and UNC Chapel Hill to train local physicians and other healthcare professionals in addiction intervention and treatment. This was done to assure that Dare County residents receive high-quality care from a credentialed and well-trained workforce.
Since initiating the plan, Dare County has seen a dramatic decrease in key health behavior indicators, showing the positive impact of our efforts. Since 2005, the number of arrests related to drugs and alcohol have steadily decreased. The percentage of students in grades 7 through 12 who participate in the school's random drug screenings has increased, indicating parents and guardians have a greater understanding and commitment to preventing substance abuse. There has also been a reduction in the number of positive drug results and refusals in the county schools' random drug screenings. With wide-ranging input and support, we have built a comprehensive, holistic, and sustainable substance abuse program for Dare County.
As a mother who lost her son, the changes that are being made within the county have been amazing. The discussion's open, people are more willing to come forward to ask for treatment, and it's really given us great hope for the community.